So you're eating the way you've always eaten, you're moving about as much as you always have, maybe even more, and somehow your body looks and feels like it belongs to someone else. You feel heavy around the middle, you feel softer, and no matter what you try, it doesn't seem to work. So if you've wondered if something is actually wrong with you, give me the next few minutes because what's happening to your body right now has a name, and it isn't lack of willpower. Hi, I'm Dr. Lola Ashaye. I'm a board-certified family medicine physician and founder of InTouch Primary Care in Sugar Land, Texas, and I specialize in primary, preventative, and menopause care. I help both men and women finally get real answers about what's happening in their bodies. So let's get into it. So this month on this channel, we're going to be spending some time on something that almost every one of my midlife patients eventually bring up, and that's their weight and their metabolism changing. And it seems to happen overnight for many people for no reason they can point to. So let's start with what is actually happening. So I see this often, typically in a patient in their 40s. She has the same, gym schedule. She's kept it the same for the last decade, same way of eating. And then a year or two ago, none of what was working seems to be working anymore. The weight has settled around her middle, her clothes fit differently through the waist, and even on the weeks she trains harder, nothing seems to happen. Recovery takes longer. The definition she used to have around her arms and legs looks softer now, and she doesn't feel like she's changed a thing. She even feels like she's working harder. She's tried eating less, but the scale barely moves. She feels worse, she feels tired, irritable, she's thinking about food in a way she never used to. And everyone just tells her to try harder. But now she's starting to think, is something wrong? Is something broken? Well, what is happening has a name. And it isn't and it's not happening because she's changing a single habit. So things to know. Number one, where the body stores fat changes as estrogen declines through perimenopause and menopause. So the fat storage tends to shift from hips and thighs towards the abdomen. And that's not about just the clothes fitting differently. That's abdominal visceral fat that behaves differently in the body. And that shift matters not just cosmetically, but medically. The other thing that happens is the baseline calorie burn drops, even at rest. So research on menopause transition points to a drop of roughly 250 to 300 calories a day in resting energy needs. So that's driven by declining estrogen and changes in body composition. So that's the baseline moving, which makes things difficult. Also, people start losing muscle a lot earlier than they realize. Muscle loss gradually begins in our 30s and accelerates through menopause transition. So muscle is metabolically expensive tissue. It helps your resting metabolic rate. So less muscle means a lower baseline burn, which compounds the changes. Also, insulin doesn't work quite the way it used to. Estrogen helps your cells stay sensitive to insulin. So as the estrogen declines, many women become more insulin resistant, meaning the same plate of food can produce a different blood sugar and insulin response that it would have 10 years ago. And that can make weight harder to shift and easier to regain, independent of what you're eating. So none of all of this shows up on standard visit. A quick weigh-in and a eat less, move more comment doesn't capture any of this. So finding out what's actually driving the change usually takes real lab work, like a fasting insulin, a full thyroid panel, sometimes inflammatory markers, and enough time to talk through your history. And that's the piece that a rushed visit typically skips. So if you're nodding along right now, thinking of one woman in your life who is quietly blaming herself for this exact thing, send this to her. She doesn't need another try harder comment. She needs to know that this is physiology, not a personal failing. And that's how we start changing the conversation for each other. So you may have heard, isn't this just because I'm not trying hard enough? Well, no. You can keep every habit exactly the same and still see real changes in your body composition in midlife because the underlying biology has shifted, not your effort. So self-blame doesn't fix a hormonal or metabolic shift, and it isn't warranted here. You may have thought, isn't this just what happens as you age? There's nothing to do about it. Well, some change is expected, yes, but expected isn't the same as nothing can be done about how you feel or function. Understanding what's driving it is what lets you work with your body instead of fighting it blind. You may feel, well, I don't want another lecture about eating less and moving more. Good, because that's not what a real workup leads to. This isn't about restriction. It's about understanding what your labs, your muscle mass, your hormones are actually doing so that any plan is built around real physiology instead of generic advice that was never built for a midlife body. Or maybe some of you feel like you don't have time to overhaul your whole life. Well, you don't have to overhaul your whole life to get an answer. You need the right conversation, the right set of labs, and that's exactly the kind of visit a rushed system usually can't offer. So, things to know. Here's what I want to leave you with. If your body has changed and nothing else has, that deserves an actual look, not a one-line comment on your way out the door. That's the kind of care built in InTouch Primary Care. So as a direct primary care practice, we offer unhurried visits with no copays or deductible, direct access to me, the doctor, between appointments, transparent wholesale pricing on labs, so getting the full picture doesn't cost a fortune. Many common medications are also included in membership, and those that are not available are available at wholesale pricing. Those that are not on our formulary are available at wholesale pricing. I'm also licensed in several states, so a good deal of this can be done through telehealth, even if you're not local to Texas. So if your body feels like it's changed and you feel like the rules have changed, I'll be glad to help you understand why. You can book a free 15-minute consult at intouchprimarycare.com. The link is in the description. And as always, remember this video is general education, not medical advice. Except I'm your doctor, think of this as an invitation to be properly looked at. So imagine this. You're understanding exactly why your body is holding on to weight differently instead of quietly blaming yourself for it. Imagine having more energy through the afternoon, sleeping better, feeling strong again in your own body, not because you did something drastic, but because you finally had the full picture. Imagine a plan built around your actual labs, your actual life, not generic lists you've already tried. That kind of clarity is actually available, but it takes someone with the time to help you find it. So if this has been helpful, I'll see you at the next one.